candidates for doing this sort of work is the emergency medical people. They see the problem. They collect enough data to be able to do these little maps and so on. David Short, the young man who did the project in California, has written a manual for emergency medical personnel. How widely it's being read and used, I have no idea. But I know it's not being used in Green Valley, and I think it should be. Any comments or questions that you would like to?
I was going to say the same thing. We have a history of falls here in La Posada. We have a history of falls, people falling.
Yes.
Sometimes the person's bones are breaking and then they fall. Sometimes they fall and the bones are breaking because of the fall. And I don't know what the causes of the falls are, or if they could be outside of that person's framework, within the context of where they are at the time they fall, maybe. And a study on La Posada campus with 700 inhabitants as a community in itself would be very, very helpful. Maybe we could do something about that.
Well, there was a survey done. I don't know the results of it recently. There are all sorts of things that you can do. For example, you mentioned people's bones breaking before they fall, particularly for people with severe osteoporosis. That's a problem. There are pads that people can wear. If you have severe osteoporosis, you can wear pads that reduce the risk of a more severe injury if you do fall. Of course, they don't keep your bones from breaking before you fall. So you need to think of it in stages of before the fall, during the fall, after the fall. And I mean, it may be that there's certain sections of our living quarters that should be softer if we fall on them.
I'll be accused of being a semanticist, but as an epidemiologist, you're concerned with the identification and correction of epidemics of, let's say, germ-borne or otherwise disease forms of illness. You've concerned yourself with rather small numbers of people who are injured or killed because of, such as theirs. You produce a marked reduction in death rate, maybe from 20 to 10, which is a small but worthwhile improvement in comparison with eliminating yellow fever and getting rid of mosquitoes. But the word epidemic has a very broad term. We can have epidemics of drunken drivers or epidemics of butterflies. And who's concerned with those epidemics?
Well, certainly injury epidemiologists are concerned with drunk driving, which is a major problem. We dealt with small populations, therefore we had small numbers of deaths reduced because there were small numbers of deaths in terms, relatively speaking. If you think about something like malaria in the tropics, I mean, this is very small potatoes. But there are huge amounts of funds being devoted now to malaria. There's a huge center at Johns Hopkins University working on malaria with Nobel Prize winning people working on it. So it's not as though they're not trying, but it turns out that there's a nice little article in the Johns Hopkins magazine, which you can probably access online, I think in the last month or so, about how difficult it is to deal with the Anopheles mosquito. There are all sorts of varieties of them, and how the malaria is transmitted to human beings and so on. It's much more complicated than this sort of thing that I'm talking about. To me, there are big problems, middle-sized problems, relatively small problems. The community has to address the small problems. There's a lot of variation among communities in the kinds of injuries that occur, where they occur, to whom they occur. And those can be addressed at the community level. There are others, like mosquitoes over large areas of countries and among countries in Africa and Asia and the tropics, South America, that need to be addressed probably in terms of how you control the mosquitoes or how you control their transmission to people and that sort of thing. But I'm perfectly willing to solve small problems and let somebody else solve the bigger one.
But you're not concerned with epidemics of butterflies?
Not if they don't do any harm to people.
There's a story, two comments, Leon. There's a story about the building of the Panama Canal where the mosquitoes were a big problem. And General Gorgas discovered that the problem was really in the holy fonts that were around and they couldn't be touched. And the mosquitoes would breed there. So he had his workers go out with insect repellent strapped around their fronts, and they would lean over the holy font and go, and the insecticide would come out and kill all the mosquitoes. I don't know if it's true, but I like the story. There is an application, a major application of epidemiology in the field of medicine, which I indicated came to me rather late. But this involves, among other things, the study of disease. And it marks the difference in epidemiologic studies between what can be done by clinical observation and by carrying out long-term studies to determine what may be the reality. For example, I've been involved for some 27 years with what's called a physician health study. And this is difficult and it's expensive because you have to have two populations. You have to have one population divided into two parts. The population has to be consistent, all the same kind of individuals. And then you have one group which is taking a medicine, we'll say, and the other group is not, and nobody knows which group is getting which. These are called double-blind studies. At the end of a period of 2 years, 3 years, 5 years, they collect the data and see what the effects have been, whether X medicine was effective or was not effective.
I have to brag a little bit about the Rotary International Rotary Club. I guess this is an epidemiological effort in eliminating polio throughout the world. They've raised hundreds of millions of dollars and in conjunction with the World Health Organization have eliminated polio except for some provinces in India and a couple of places in Nigeria. And it's more, is that an epidemiological kind of thing?
The premier example of that was smallpox. Smallpox has been eliminated. And the people who did it, there was a physician at Johns Hopkins, physician epidemiologist named Henderson, and people at the Centers for Disease Control. And they literally went in, trained people in India and Africa and went into every little village, and every time there was a case, they traced it out and got isolation and all the things that it needed to happen. And they literally eliminated it from the face of the earth. And as you indicate, I didn't know that your organization was that involved in it, but that effort is ongoing now. And as you say, there are just these little enclaves left that need, and hopefully it will happen.
On the subject of falls in La Posada, I have for a decade been pointing to the fact that falls are covered by the emergency service here, and they're all reported, the location, what happened, when and where, and it seemed to me those data could be collected and you could get additional information which might lead to some preventive effects. Now the difficulty with that is that many falls are not reported. People will fall and they will have some kind of an injury and they won't report it. But I think if there was an all-out study, it would not report there's something wrong with La Posada. It would report out what the natural hazards are, whether it's curbs or something else which is causing it. But it is one of the major health hazards in a community like La Posada. And I think by collecting those data over a period of time, much could be done in the way of prevention. Back here.
Yeah, that was a wonderful presentation of how to apply epidemiology on a